All right, everyone. We've got Dr. Ryan on the phone, and we'll be talking about the vaccine and anything else that comes up along the way. Good morning, Dr. Ryan.
Good morning, Mark. How are you?
Well, hanging in there, and encouraged by the historic day yesterday. It really was a historic day if you think about it. We certified our next president. We passed a grim milestone of 300,000 dead across the country, but at the same time, we rolled out the vaccine, and those images of folks receiving those initial doses was very encouraging, wasn't it?
It's a great day in American history, to be sure.
Well, now comes the hard work, I guess. There's so much to do in regards to the manufacture, the distribution, and the giving the vaccine to those that need it, inoculating those that can help us if we get in trouble later on. That's the first responders, and finding those populations that need the vaccination the most. I have seen the CDC guidelines, but I'm not exactly sure what how they have been interpreted by the state. Maybe you could elaborate.
In terms of the vaccination distribution, the state is really relying on each individual county. Just as an example, here in Clark Creek County, as you know, we don't have a hospital, so we don't technically have people who fall into that Tier 1A. So our vaccines that we will likely be receiving next week, we will shift down to the Tier 1B, which, as you alluded to, includes EMS and firefighters, law enforcement, et cetera. And then we will continue on down into the 1C group once everyone in 1B is vaccinated, that wants to be vaccinated. So, and then including our more of the individuals who fall into that necessary work, right? We have teachers and a whole host of individuals out in the community who, if they don't show up for work, it's going to be a problem for the broader community. So we're going to be focusing on those individuals with each week's vaccination distribution. And we're reaching out to everybody, each group, a priority before we get going, to understand, one, how many people are in that group, how many individuals are going to be receiving the vaccine from us, as some do qualify through their work to get it somewhere else. So we're trying to understand what our total number need is in terms of vaccines.
Yeah, I heard you say that the first responders would be the initial recipients of the vaccine, and I'm sure that they'll be easy to identify. I wondered, it seems to me that the most vulnerable population might be our residents of Mitchell White and others in that age group throughout our community, and I wondered where they stood in the queue.
Yes, agree. The folks at Mitchell White are definitely high on the list, and they are going to be one of the some of the ones that received some of the first vaccines that we get. So we will likely be receiving 100 or plus vaccines every other week, and that very well may change. But as we receive those, we will be disseminating them out to those groups. EMS, as I said, fire, law, and then the folks out in the community who are more susceptible than others.
Well, I also heard you say that we will be receiving the Moderna vaccine, and I know that I've read Moderna is a company that has never mass-produced a vaccine anywhere near this level before, and I wonder if you have any sense of how their production capacity has been ramped up to accommodate the 200 million doses that they've committed to providing in the United States.
Well, the good news is Moderna has been partnering with NIH and Dr. Fauci in particular since day one. So it's been a partnership between those two. I also believe that Moderna has contractually agreed with other manufacturers to help them manufacture. To your point, they've never manufactured any vaccines at this level before. So they have, over the last 7 or 8 months since the start of this whole thing, been identifying and coming into contractual agreement with those groups to help them manufacture and meet those numbers.
Well, that's good news. I'm glad to hear that. I hope that things go well. I know that there could be some issues within the supply chain, raw materials. I heard recently, I couldn't believe my ears when I heard this, but the mRNA vaccine, one of the components of producing that vaccine is a component of the PCR testing. And that there might be some supply shortage either for testing or for vaccines around that. I don't know, maybe that's a little too deep in the weeds, and hopefully they'll have that resolved. But I know that there could be other issues, the glass vials and syringes and all the rest of that. What's the supply look like from your perspective?
Well, in Clear Creek County and in Colorado, I think we're doing well for supplies. We've anticipated the need many weeks ago, and so began that process of getting everything that we need to distribute the vaccine. As far as nationally, yes, I understand that as well, that there are some supply chain issues. It's what caused Pfizer to reduce its initial vaccine distribution numbers. Because of that supply chain issue. So I'm not in those weeds so much nationally in terms of what they're doing and struggling with. But again, it gets back to the age-old problem of not having an actual national plan since day one. And so it's been everybody fend for themselves and good luck. And now we're seeing that and have been seeing that in spades over the last many months. And that problem is going to persist. Hopefully, as you alluded to earlier, with the new administration, we might see a change in that, in an actual national plan, in that we can more have a better supply chain in terms of what the vaccine providers need.
Well, 36 days from now, we'll see what that new plan will be. I have no doubt in my mind that there will be some national initiative after the inauguration, and I just hope that it's sufficient to meet the need. I'm wondering. I thought I heard you say in your COVID report to the county commissioners that the Board of Health would be administering all of the COVID vaccinations within the county. Is that the long-term plan?
In terms of the Department of Health, we will initially be doing that. Safeway, I heard yesterday that Safeway will likely be receiving some vaccines and will be doing it out of Safeway. My initial understanding is that will be for Safeway employees only. I don't know if there are any plans for the pharmacy to distribute them more broadly. That wouldn't happen either way. It wouldn't happen until we got to Tier 2 or 3 anyway, in that Safeway would be able to get access to those sorts of vaccines. So that's initially for the coming months anyway. The Department of Health, my team will be the ones distributing the vaccine. In Clear Creek County.
Okay, so for the foreseeable future, any and all of the vaccines available to the public, whether they are in Tier 1, 2, 3, et cetera, those will be administered through your department. All right, I think I understand that, and maybe sometime they'll expand that to physicians' offices and et cetera. But I just trying to keep track of who's been vaccinated and who has received their second dose. That seems like a logistical nightmare to me. I'm sure there's going to be some issues around that. I know that you'll keep great records, but when you start trying to coordinate records across jurisdictions, that could become complicated. Does the state have a plan for collating that information?
They do. There is the good news is there's a statewide vaccination program that keeps track of all that sort of thing, keeps track of every vaccine you've received, and so we'll continue to do that. When we distribute the vaccines to individuals, we're required to enter that into that state system, so the state knows. It's also the way the state understands our distribution. So we have 72 hours to distribute each batch of the vaccine. If we don't distribute it within 72 hours, the state will come back and get it and take it to a county that can distribute that. We have every intention, and I'm fully and confident in my team in distributing the vaccine in a timely manner and won't be in a position like that. But we're also having a system of redundancy, so not only the state data set in keeping track of the vaccine, but also we're going to keep track of it ourselves in a spreadsheet and make sure that we're keeping track of who's getting the vaccine, when they're getting it, when they need to return, and that sort of thing. This Moderna vaccine, as you know, is a two-shot regimen. It requires a 28-day space between shot 1 and shot 2. And so we'll be keeping track of that and making sure that individuals come back for their shot at the appropriate time.
I'd like to go back to the tiers and those vulnerable groups that will be higher on the priority list. I heard you say the first responders, of course, everyone sees that, and then the elderly, most susceptible within that older population. And then I wonder beyond that, because then you start getting into some what could become political issues. But it seems to me that and I don't have your direct knowledge, but it seems to me that places where people are congregated by necessity would be places of high incidence of transmission. And I'm thinking in particular of the jail, and I'm thinking in particular of the some of the motels that might house 6 or 7 different people. Maybe they work at the ski area or at one of the fast food restaurants here in Idaho Springs. Those populations seem most likely for transmission and contraction of the virus, and I wonder where they stand, even though politically that might be out on a limb.
Yeah, a great question, Mark. And all of this is sort of in the context of we're going to be receiving 100 vaccines at a time. So, yes, I wish I could vaccinate everyone instantly, but we're going to have to roll it out as we receive those vaccines, and we'll distribute every vaccine that we get as we get them. So anyone in the county who wants a vaccine will likely receive one within the next 5 or 6 months at the very longest. As far as prioritization, we're following the CDC guidelines. There are, even within EMS, fire, and police, there's more people in that group than we have vaccines in this first round. So we're going to stagger each of the tiers. We're going to try to stagger the vaccination so that individuals in EMS, we're not vaccinating all of them at once. We might vaccinate half and then do the next half the next round and that sort of thing. So what we're doing is again, following the guidelines of the CDC as it relates to our county. There's obviously, as I stated earlier, we don't have a hospital. We don't have individuals in Group 1A. So we're moving on to 1B and following the guidelines as that goes. We're not going to publicize who, in fact, is receiving it on any given week. Those groups will know. We will obviously contact them. But I am not interested in this most public health crisis to get into the who should go next and who should go next and getting emails and phone calls of I should go next. That's being determined on a much broader level, and as individuals get into the queue, and we will vaccinate them as quickly as humanly possible. There are many populations that I would love to vaccinate on day one. But we're just not going to receive enough vaccines at any one time to vaccinate anyone in every group.
Understandable. So let's say let's play this out a little bit. You're going to have your priority list, and eventually you'll get to a list that will be maybe harder to identify than first responders or teachers or residents of Mitchell White, and now you're in a broader population. Let's say it's folks over the age of 65 who have some comorbidity. There's been a lot of talk about the priority for those folks. How would you know who to contact, and what sort of process would you use to discover that population?
Well, at this point, we are in the 1A, 1B, 1C tier where we do have a really good sense of who's actually in that grouping. To your point, when you get to tier 2 and tier 3, and hopefully by the time we get to that point, we're receiving more than 100 vaccines at a time. I could foresee us getting 250, 300 vaccines, even more, where we do have the capacity to distribute those in a 3-day window. And so at that point, it's not a matter of trying to identify everybody. It's more, if we do get 300 vaccines, we put out a press release in our webpage and on Facebook and all the other social media sites that they are available, and please call to schedule an appointment and do it in that fashion. I don't think it's possible for us to identify everyone out in the community and then contact them directly. Way too time-consuming and not how we're going to proceed. So we have a great team. The vaccination planning, as I said, is going fantastic. Olivia Watson is doing a great job at spearheading that, making sure that we have everything we need and that the right groups are in queue in terms of when they might get vaccinated. We don't want to get too far ahead of ourselves, having said that, and start getting emails and flooded with phone calls about how they want to schedule their vaccination. We're not there yet. When we get there, we will let the broader public know first and foremost, and move forward in an efficient and effective manner. We don't want to cause chaos. We want to disseminate this vaccine as quickly and efficiently as possible, and I think doing it in the way that we're doing it will allow us to do that.
Okay, I think I hear you saying that when it comes time for some broader group, that when you put that information out, it'll go through the channels that you advertise the testing regime, and you'll have, for instance, on the county website, and maybe over the radio, and on Facebook, of course. So that makes a lot of sense. What about? I was just curious about this 2-dose. Need, and the people that are going to be difficult to find for their second dose. You've got a homeless population. Well, let's call it a transient population, of which we have a certain number here in Clear Creek County. There's snowbirds, people who are on the move, and maybe they would receive their first dose while they're in Florida, and then they come back to Clear Creek County and require their second dose. I'm just curious if you have any thoughts on how that might how they might be able to receive their second doses.
Yeah, you just described some of the more logistical challenges that we face moving forward. One of the things that we're asking people, even in this initial group, is Monday or Tuesday of next week or Wednesday, we don't know the day yet, you're likely to receive your first vaccine, which makes your second vaccine on January whatever. Are you going to be around? If their answer is no, I'm going on a week's vacation, or I'm going so-and-so, then they're not going to receive their first vaccine on that day. So right now we're trying to sort of jockey that to make sure that individuals are going to be available for their first and second shot. To your point, though, when you get out to the broader community and you're not dealing with EMS and firefighters and law enforcement, it makes it a lot more difficult. And there's very limited things that we can do. We can call people and remind them. We can do a number of things, but we can't drag them in and make sure they get their second vaccination. But we'll initially try to have a discussion with individuals about that and make sure it's clear that it's very important that they come back for their second vaccination. You would think that people that are going out of their way to get this vaccine, that they would have some skin in the game and some desire to come back for that second shot. And so we're hoping that will drive people to come back and to get that second shot, because the second shot in the Moderna vaccine is absolutely critical to help give you that 90+% efficacy.
Well, you would certainly hope that that anyone who showed up for their first test would be willing to come back, or vaccination would be willing to come back for their second. But people's circumstances are weird sometimes, and I'm sure there's going to be a certain number of people that aren't going to receive that second shot. And then of course, you'll have your vaccine deniers, and then there are other special groups of folks who can't even receive the vaccine, aren't there? There's pregnant women are now, that's kind of an unknown at this point. Children under the age of 16, people who are immunocompromised on cancer treatments, maybe they have anaphylactic history. There's a fairly large segment of folks who will never be able to receive the vaccine. Is that right?
That's correct. And some of those groups will be included in the future. The under 16, as you suggested, there is currently an ongoing study in the vaccines looking at 12 to 16-year-olds. So that age group will eventually decrease, and hopefully that clinical trial will be done by the time that group comes around for their vaccine. So, but yes, there are a number of other individuals, and this is all the more reason that everyone else needs to get their vaccine. For individuals who can't, physiologically or whatever reason, need the protection from everyone else. And that's the whole concept of herd immunity. 100% of people can't get the vaccine, so it's reliant on and incumbent upon the rest of us to help protect them, because they can't protect themselves. And that's where the vaccine comes in. It's allowing us to protect not only our individual selves, but to protect those other individuals around us who cannot get the vaccine.
Yeah, I kind of see that as a civic responsibility, much like voting or paying your taxes, supporting your larger community in those ways that make it better for everyone. And I just, my fervent desire is that the folks who have resisted wearing masks for whatever reason see that this is the key to our future, and that if they don't feel that if they don't see the obvious benefit to themselves, maybe they'll take their community, the good of their community, into their calculations and go and get the vaccination. That's my hope, because herd immunity is what we're after, and I have a few quick questions about that. But what do you think? Do you think we can convince the folks who wouldn't wear a mask that they might want to get a vaccination?
Absolutely. You have one of two options. You can either wear a mask or you can get vaccinated, or both. And if you're not willing to do either, but you somehow want life to go back to normal and you want things to return, those are our only two options to get things back to normal. So it's one or the other, and or both. You can't just not do anything. I don't believe that that's being an active, honorable member of the broader society. And that's what makes us strong, is the will of everyone to work together and make sure that this sort of thing happens. And so, there's going to be those sorts of people out there, and it's going to be incumbent on the rest of us to pick up their slack, so to speak. Unfortunately, they do exist, but I think through the will of everyone else, through vaccination and social distancing and mask wearing, we will hopefully get this under control.
Yeah, but hopefully we will. The question is when that might be. That's going to be some time from now, I'm sure of that. But it seems obvious to me that even if there's a slow rollout of the vaccines, that every step along the way will incrementally improve our situation. Less people in the hospital, less deaths, less people who have to isolate for 2 weeks and can't go to work. That seems obvious to me that'll happen along some continuum, and that the further we go, the better off we're going to be. But it's going to be some months, and there's going to be a switch flipped, is there, where all of a sudden we're at herd immunity, and now we can go back to Disneyland.
Right. I mean, the public health impact of the vaccinations is going to be several months down the road. It's not going to be instant, to your point. It's going to take time to vaccinate people, particularly if we're only receiving 100-shot vaccines at a time. And so moving forward, we're going to need to continue to wear masks and social distance and not have holiday parties and not do those sorts of things. And drive our numbers down as much as possible. That, in concert with the vaccine distribution, will have an impact, but it's going to take a few months, and so patience is needed. I know we've been hearing that now for 9 months, but it's true. And me telling you something different doesn't make it true. It's reality. Patience is needed, and continuing doing what we're doing. Wear your mask and social distance, and the vaccine will help augment that even further.
Well, as far as when it's going to be safe to take the mask off, if ever, when it's going to be safe to resume some normalcy in our lives, I'm going to personally rely on Dr. Fauci to let me know when that day is, and I'll listen for you to second that. In the meantime, I think I've read that the Pfizer has contracted with the United States for 100 million doses, Moderna with 200 million, I believe, and so that's divided by 2 because of the double dose. That's 150 million people that will be vaccinated through their manufacturing and distribution processes, and then the vaccines given locally, of course. That leaves a big chunk of people, and I guess there's a potential for more vaccines from those 2 companies later on. But as far as what's in the pipeline, I understand Johnson & Johnson expects to have their phase 3 trials completed maybe in January or February. Do you know much about that?
Yeah, there's 3 additional companies. One is escaping my mind at this point, but AstraZeneca and Johnson & Johnson are the 2 others. Both of those companies, as well as the third one, and I can't remember off the top of my head, will have finished their phase 3 clinical trial in the coming months or so, and then a quick turnaround time there. The good news is they're already manufacturing the vaccine, and so when you bring those 3 additional companies into the mix in terms of vaccines available, our numbers will jump up significantly. Most importantly in that group is the kids. Everyone under 16 is a huge chunk of the U.S. population, and we can't vaccinate them anyway until the phase 3 clinical trials are done. So hopefully by the time those 3 other companies roll out theirs, we will have those clinical trials done for the younger groups, and we can begin to vaccinate them as well. And so I think a substantial chunk of the American population will be vaccinated by summer. Most people who want it will be receiving it by then. So I'm not too concerned about the initial rollout from these 2 different companies. And their manufacturing capabilities very well may pick up here in the next few months. As we've talked about before, the supply chain issues get worked out in the coming months, and hopefully they can continue to pick up their manufacturing capabilities.
Well, I didn't mention AstraZeneca because they've had some, let's call them complications with their process, and so I feel like that's an unknown when that one will be available. But Johnson & Johnson looks likely within the nearer future than any of the others. I also know, I think I know, that Johnson & Johnson is going to be an easier vaccine to distribute. It won't have to be kept cold in the same way that the mRNA of vaccines need to be kept cold. And could be more easily distributed around the world, especially to places in the third world and in less developed countries, because we know that until it's under control worldwide, there is no control.
Correct. Yeah, it's a pandemic, and it will continue to be a pandemic, regardless of what America does on its own. So, to your point, as more companies come online, and there are dozens around the world who are actively in the process of either developing the vaccine and or under clinical trials. So, and China is included in that, and I know China's vaccines are being sold to a number of the developing countries in the developing world, in Africa and other parts of Asia. So, it's going to take many companies and many vaccines to cover the world's population. There's a lot of people who live on this planet, and so to vaccinate all of them in a short period of time, relatively speaking, is going to require a monumental task.
Well, just one more quick thing that I wanted to get after was this transmission of the virus even after vaccination. Is there? I don't know that I can discover through my investigation whether or not they know if it's going to be protective. If you're vaccinated, you're going to be protected from spreading the virus to others. There's still some question around that. Is that right?
That's correct, and that's why they're actively, even though the clinical trials have quote-unquote finished, they're still ongoing in that they're following these individuals and will continue to do so for the foreseeable future to better understand that. So there's two levels, right, of protection that it's offering. The first and foremost is it's protecting you from getting COVID, in particular symptoms from COVID. The second is that transmission. You very well may have been exposed to COVID, and you're not going to have a reaction because your body can fight it off enough, but you still may have the ability to transmit it to other individuals. That is still under investigation, and they're still trying to get a conclusive answer on that. But these are the sorts of things, and why the development, et cetera, of vaccines takes so long is that these things are ongoing. Even though we're actively distributing the vaccine, answering those questions is still at the forefront of what the clinical trials are trying to understand. That will help the next generation of these vaccines, right? Information they learn from the ongoing observation will then feed into the development of the next generation of vaccine. This one, as it stands, at a 90, these first two anyway, 90-plus efficacy, is incredible. And will offer a significant amount of protection. But it's all the more reason to your question why everyone who can should get vaccinated. It will help protect everyone around them that doesn't have that luxury of being able to get vaccinated, meaning they can't for whatever medical reason. So, again, it's incumbent upon all of us to help and do our part in what we can to help mitigate the current pandemic.
I'm glad you mentioned the efficacy in trials, because I've heard people say, I can't wait to get my vaccination so that I can resume my normal life. Well, wait a minute. There still is some significant chance of contracting COVID. Maybe it's going to be less severe, but you can still contract the COVID. Some portion of the population will still be susceptible, and you might be able to transmit the virus to others anyway. So I don't see any reduction in the safety measures we've been employing for the last 9 months. I don't see any reduction in those in the foreseeable future. Do you?
I agree, Mark. Several points I want to make. The first and foremost is the vaccine is only half about you, and the other half is about everyone around you, including people you don't know. Excuse me. So the vaccine, yes, it does help protect you, but more importantly, as we've been discussing, it's as important as protecting everyone else around you. The second thing is, even if you've had COVID over the last 9 months or so, I highly recommend you still get a vaccine. We do not know in any individual how your antibody response was and how much of protection you still may have. So to say, I had COVID, I don't need the vaccine, is incorrect. Whether you had COVID or not is less relevant, and you should get the vaccine. It will help further booster any immune response you already have and help further your protection moving forward.
All right, Dr. Ryan, thank you so much for joining us today. I want to give you an opportunity to make any other last comments that you might want to make. I know that you're a busy man, and it's time to move on. So is there any closing comments you'd like to make here?
Mark, as much as I enjoy our conversations, what is now a weekly event, the only thing I would say is what I've been saying for months. Please wear your mask. Please social distance. Do not have social gatherings over the coming weeks. Do not get together with family and friends for Christmas or the holidays. It is not worth it. It will take Colorado and Clear Creek County's numbers back up and in the wrong direction. And if we want to prioritize and make businesses our number one priority and school our number one priority, then those are the sorts of things we want to do. If we want to be selfish and do those sorts of things, then those other things like schools and businesses in our community, and which support all of our neighbors, are absolutely critical. And so I would ask people to do the right thing. Don't have social gatherings. Don't go anywhere for the holidays. Stay home. And we're almost through this, and giving up now will only set us back to where we were before, and I really don't want to go there. I want to move forward. I want all the businesses in Clear Creek and Colorado and the country to open back up. I want school to resume and make it so that kids can continue to learn and thrive, and not do what we've been doing. So I would ask everyone to do the right thing this coming season and help out your neighbor, help out your community by doing the right thing and staying home.
Those are great words to end on. Thank you so much, Dr. Ryan, and we'll speak again next week if you've got the time. It's a fast-breaking story. There's something new all the time to talk about. You have been a generous and great resource to us, and we deeply appreciate it. Thank you so much. Talk to you soon.
As always, Mark, be well.
Bye.